Welcome to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. You started Jardiance to lower your blood sugar. Maybe your doctor said it would help your heart, or your kidneys too. And it is working. Your numbers are improving. But now you are dealing with something else. You are running to the bathroom all the time. And those headaches are starting to get old. These side effects are not random, and they are not a sign that something is wrong with you. They are predictable, manageable, and in many cases, temporary. In our first Jardiance video, we talked about the most common side effects, but we did not tell you how to deal with them. This video fixes that. Segment 1. Why Jardiance makes you pee more. The most common and most reported side effect on Jardiance is frequent urination. Jardiance belongs to a class of drugs called SGLT2 inhibitors. Here is how they work. Normally, your kidneys reabsorb glucose back into your bloodstream, but Jardiance blocks that process. Instead of going back into your body, the excess glucose is flushed out through your urine. That is how Jardiance lowers your blood sugar. It is the drug working as intended. In clinical studies, increased urination was reported in a relatively small percentage of patients. But in the real world, many more people notice it, especially in the first few weeks. That is because your body is suddenly dumping excess glucose and water that it used to hold on to. That extra urine is carrying sugar out of your body, and that sugar pulls water with it, which means your body is losing more fluid than usual. And that is where the headaches often come in. Segment 2. The Dehydration-Headache Connection. Before we get to solutions, we will talk about why headaches happen. Headaches on Jardiance usually come from one of two places: dehydration or low blood sugar. Let's start with dehydration. When you urinate more often, your body loses fluid. If you are not replacing that fluid, you can become mildly dehydrated. And one of the first signs is a headache, usually dull, persistent, and sometimes paired with dry mouth, fatigue, or feeling lightheaded when you stand up. Certain people are more at risk. If you are over 65, taking diuretics, on a low-sodium diet, or have kidney issues, you need to be especially mindful of hydration. Now, the second cause is low blood sugar. Jardiance alone does not usually cause hypoglycemia. But if you are also taking insulin or a sulfonylurea, like glipizide or glimepiride, your risk goes up. And headache can absolutely be a part of that picture, along with sweating, shakiness, hunger, or a racing heart. So how do you tell the difference? A dehydration headache tends to build slowly and feels dull. A low blood sugar headache often comes on faster and usually brings other symptoms with it. When in doubt, check your blood sugar. That removes the guesswork. If you need relief and you have ruled out low blood sugar, acetaminophen, Tylenol, is generally the safer choice with Jardiance. Ibuprofen, Advil, or Motrin can carry additional risks with this medication, especially if you are dehydrated or have kidney concerns. For occasional use, it is usually fine, but if you take them regularly, talk to your doctor. Segment 3. Practical solutions. Let us start with hydration, because if you are urinating more, you need to drink more water. A general target is 6 to 8 glasses per day, but that is a starting point, not a rule. Your needs may be higher, especially early on in hot weather, or if you are active. And timing matters. Do not chug large amounts at once. That just sends it straight to your bladder. Instead, sip consistently throughout the day. A simple check is to look at your urine color. Pale yellow usually means you are well hydrated. Dark yellow means you need more fluids. Also, when you lose more fluid, you're also losing electrolytes like sodium and potassium. If you are drinking plenty of water but still feel off, lightheaded, or headachy, adding a low or no sugar electrolyte drink can help. Next, let us talk about timing your dose. Remember that the increased urination is not a side effect you can eliminate. It is the drug working. The goal is to manage the disruption, not stop the peeing entirely. However, if you are waking up multiple times at night to use the bathroom, it is worth taking timing into consideration and talking to your doctor. Some Jardiance users who initially took their dose later in the day report frequent overnight trips to the bathroom, often around 2 or 3 a.m. Shifting the dose to first thing in the morning and making a point to use the bathroom right before going to bed can significantly reduce those nighttime disruptions. For many, that simple adjustment is enough to get through the night without waking up. Also, give your body a little time to adapt. For many people, the frequent urination is most noticeable in the first few weeks and then improves as the body adjusts to the medication. Now, if you are also on insulin or a sulfonylurea, This part is critical. Check your blood sugar more often when starting Jardiance or after dose changes. If headaches are tied to dropping glucose, catching it early makes it easy to fix. Segment 4. When to call your doctor. Most of the time, these side effects are manageable, but there are clear situations where you should not try to push through it. If your headaches are severe, persistent, or come with confusion, nausea, or vomiting, get medical attention. If you feel dizzy or weak when standing, even when you are drinking fluids, you could be more dehydrated than you think. If the frequent urination is disrupting your sleep night after night and not improving, that is also worth a conversation. Another important point that often gets overlooked is the increased risk of urinary tract infections and yeast infections. Because Jardiance causes more glucose to be excreted in your urine, it creates an environment where bacteria and yeast can grow more easily. This does not happen to everyone, but it is common enough to be aware of. Early symptoms can include burning with urination, itching, redness, unusual discharge, or a strong or persistent urge to urinate. If you notice any of these signs, contact your doctor. These infections are usually easy to treat, especially when caught early, but they should not be ignored. There is also a less common but serious condition to be aware of, called diabetic ketoacidosis, or DKA. SGLT2 inhibitors like Jardiance have been linked to a small increased risk of this, and in some cases it can occur even when blood sugar is not extremely high. Watch for symptoms like nausea, vomiting, stomach pain, unusual fatigue, or rapid breathing. If you feel significantly unwell, especially in combination with these symptoms, seek medical attention right away. This is rare, but it is important to recognize. Managing side effects like frequent urination and headaches starts with understanding how your body responds to what you put into it. Food choices matter. That's why we created Mindful Eating for Diabetes. It's free, it's practical, and it's designed to help you figure out which foods work for your blood sugar. Just use the QR code on screen or use the link in the description below. Segment 5. Final thoughts. Frequent urination and headaches on Jardiance are not signs that something is wrong. They are often signs that the medication is doing exactly what it is supposed to do. The extra urination means your body is clearing excess glucose. The headaches are often your body asking for more fluids, or occasionally signaling a low that needs attention. Stay hydrated, pay attention to your body, watch for patterns, and give yourself a little time to adjust. Most people find that these side effects become more manageable, or fade, once they understand what is happening and make a few simple changes. But if something does not feel right, trust your instinct and call your doctor. You can get the benefits of Jardiance without feeling miserable. You just need the right strategy. What are your thoughts about the side effects of Jardiance? Comment below, we'd love to hear from you, and please share this video with someone you know who takes Jardiance. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.